Love this comment. It touches on a really complicated topic. Uh, no way I can do it in 3 minutes, so I'm just going to talk about one piece here. What can you expect when you pick up a pharmacological agent from the drugstore versus natural medicine, an herbal remedy, something like that? First, it's important to understand the history. Humans have historically found substances in the environment that have helped with some kind of issue: penicillin, the opium poppy, and so on. And we would then use those in order to solve problems, pain, for example. Then, as humans often do, we said we're going to try and make this better. So we would take those substances, explore what it was through study that made things improve, and try and distill or extract just that piece of the larger element and get rid of all the extra fluff. That's the theory. As a result, what happens now is when you go to your pharmacy and pick up a medication, you get that one refined substance in a pretty predictable amount. So if you go and you pick up some hydrocodone for pain, you can confidently know that the amount in the pill is the amount it says on the bottle, right? For better or worse. In contrast, herbal remedies go back to those plants, right? Put them into often a pill form, or you just go get the plant, as some people do. And the change there is each plant may be a little bit different in the concentration of those underlying chemicals that are causing the change. So there is less predictability in natural elements compared to pharmacological agents. In contrast, though, we have found many cases where we were wrong about our assumption of how those drugs worked. Cannabis is a great example. I know that's politically charged right now, but briefly, we have THC pills, predictable, reliable. Patients report they don't work as well because we now know cannabis effects are the result of all the cannabinoids and terpenes, etc., in the plant. And we're still studying to understand that better. So the downside often of pharmacological agents is we're starting to find they're not always complete. And so some people prefer the natural variant. On the other hand, there are more political pieces to this that I'm not going to get into, but just to say that is one of the key pieces that you can expect. Do you take sort of the natural occurring version of something with the risks and rewards of the unpredictability and greater amounts of substance, or the pharmacological agent that is predictable, reliable, but specific? Ask some questions in the comments. I'm happy to follow up on some more.